Hello, dear friends and subscriber. Today, we will be talking about bronchiolitis. What's bronchiolitis? Bronchiolitis is a common lower respiratory tract infection in infants under 2, usually caused by the respiratory syncytial virus, RSV. Risk factors include age under 6 months, premature birth, low birth weight, and underlying health conditions. Management involves an initial assessment and diagnosis, which involves 1. Clinical evaluation. This means assessing the respiratory rate, oxygen saturation, and overall clinical condition through history taking and physical examination. 2. Laboratory tests, not routinely necessary, but may include viral DNA testing, EEG, RSV, as well serological investigation and a complete blood count, CBC. 3. Imaging, chest radiograph, CXR, may be obtained to rule out other conditions, e.g. pneumonia. General management principles, however, involves 1. Supportive care, which is aimed at relieving symptoms and supporting respiratory function. 2. Oxygen therapy, which involves providing supplemental oxygen to maintain oxygen saturation greater than or equal to 90%. 3. Fluid management, ensure adequate hydration, but avoid overhydration. 4. Nutritional support. Encourage mothers to continue breastfeeding or formula feeding. Consider nasogastric NG tube feeding if necessary. Pharmacological interventions. 1. Bronchodilators. Not routinely recommended, but may be considered in patients with underlying asthma or wheezing. 2. Corticosteroids. Not recommended for routine use, but may be considered in patients with severe disease or underlying asthma. 3. Antiviral medications. Not recommended for routine use, but may be considered in high-risk patients, e.g. premature infants, with RSV bronchiolitis. Respiratory support. 1. Nasal continuous positive airway pressure, CPAP, may be used in patients with severe respiratory distress. 2. Mechanical ventilation may be necessary in patients with severe respiratory failure. Monitoring and discharge criteria. 1. Wacom. Monitor respiratory rate, oxygen saturation, and overall clinical condition. 2. Discharge criteria. Patients can be discharged when they demonstrate improved respiratory status, ability to feed and hydrate adequately, oxygen saturation greater than or equal to 90% in room air. Prevention. Prevention is better than cure. Hence, the following preventive measures can be followed. 1. Passive immunization with palivizumab, administered to high-risk infants, e.g. premature infants, during RSV season to prevent severe RSV disease. 2. Provide infection control measures. This involves implementing standard precautions, e.g. hand hygiene, mask use, to prevent transmission of RSV and other respiratory viruses. Remember to consult local guidelines and expert opinions for specific management recommendations. Like it said, common things occur commonly. Please remember to share. I still remain your humble Dr. Profundus.